So now we are on live, sir. We will wait for 2 minutes so that our viewers can also join in. So now we can start. Welcome, good evening, everyone. Welcome to Farmina Nutrition Hour. Today we are going to discuss on an interesting topic, a challenge, a doubt, which every pet parent feels while raising a puppy or a kitten. So our topic of discussion for today is understanding your pet's upset tummy. I am Dr. Anish Pillai, vet manager for Farmina Pet Foods, and with me today our expert is Dr. M. Chandrasekar. Dr. M. Chandrasekar, he is a professor of Department of Veterinary Clinical Medicine and Therapeutics, and he is also the in charge of Critical Care Unit of Madras Veterinary College, Chennai. He is also a founder and CEO of East Coast Pet Hospital in Chennai. He has more than 2 decades of experience, more than 20 years in teaching, and more than 25 years in clinical practice. He has also been to Michigan State University and Oklahoma State University, where he underwent training on oncology, which means cancer, and also on recent advances in veterinary medicine. He has published many articles in national and international journals, and he is also a member in various prestigious affiliations like Small Animal Practitioners of Chennai, Indian Society of Veterinary Medicine, and he is also a lifetime member of Indian Veterinary Journal and Kaalnadai Kadhir. It's an honor, sir, that you are here. Welcome, sir.
Yeah, thank you, Farmina, on that team, and Dr. Anish for inviting me to interact with the pet parents. It is a unique opportunity to hear the pet owner's feeling, and we are ready for the conversation.
Yeah, thank you. Sir, to begin with, sir, as I mentioned, you have more than 2 decades you are into this industry. Can you please help us to understand, or can you brief us about your journey so far, how you started your career, and how the industry has evolved till now?
Yes. Yeah, now the current area, the social media area where we are meeting the industry and the pet parents. And I'm talking about 1993 when we passed out, it's mainly no communication, only phone is the device. Even the college or my practice, how I manage, I have to go to the telephone. And after that, it move on to the pager. The pager, getting the pager, there will be a lot of queue. People will be standing. The i5 people only they buy. And another important thing is pager, one message is 5 rupees. And getting the pager, a lot of people will stand. I am the first veterinarian who bought all this pager for my professional development. Then another thing, then after that, that was there for a couple of months and year. Then move on to cell phone. The cell phone, it will be like a bricks. I used to have a big cell phone. I am the first veterinarian who used a mobile phone for my practice. And everybody criticized why this man is using a cell phone for his practice and all, They say, why telephone is there? Ordinary landline telephone is there? Why he is using this? See, anyhow, I could understand the importance and emergency interacting with the pet parents. Sometimes talking to the owner itself, they will be convinced with the pet problems. So that is the way it will coordinate with me. Now the availability of social media, WhatsApp and Instagram, Facebook and Twitters, and more of very friendly way in which.
And nowadays we have ultrasound also on the phone, app for ultrasound.
App for ultrasound, very diagnostic kit available. And actually, I'm amazing to see all this technology development in the veterinary profession. Whatever any technology comes, I always think that it should be applicable to veterinary profession, especially pet animal practice, because it is a family member in the family. That's the way I used to think. Olden days, we used to go a long place, we travel for the treatment and all. Now I could see more of many clinic and many specialty hospital
And
and
pet parents
individual
also, pet
pet
parents
parents
also
also
allowed to bring their pet to the
pet to the
hospitals.
nearby hospital, and they see that they view the veterinarian capability by looking at the review and other things. The people come to the practice. These are all the some quite interesting thing. From 25 years, we could see a lot of changes.
Yes,
Yeah.
that's interesting actually.
Yeah.
And sir, now coming to the topic, sir,
Yeah.
as I mentioned during the introduction session, that the most common problem which a pet parent sees from the day when they start to raise a puppy, they
Yes.
begin to notice one is the skin of the skin or hair of the puppy or kitten and the motion of a kitten. So can you please explain to the viewers how a normal stool should look like?
Yeah.
And when should a pet parent raise an alarm after seeing the stool?
Yes. The first important question is the shape of the stool. That is very important. Then
Okay, sir.
color of the stool. Then consistency of the stool. So these are all more of technical word. Coming to as a pet parent, what they need to look at it, and how the stool is formed. They say it should be like a snake. If you have a difficult snake-like structure, or sausage shape like such, you all use sausage for taking soup. This type of shape structure, it indicating a healthy gut.
Okay.
That's very important. As a pet parents, we need to take him for a walk, or in the premises is walking. When it's voiding the stool, this stool is very, very important. When you look at some abnormalities like any presence of dark color, that means there is some bleeding from the posterior part of the GI tract.
Posterior part means lower part of the intestine.
Lower part of the intestine. Another important, if you are seeing the fresh blood, that means colon, rectum region, it may be having infection or bleeding from that site. That causes the changes. Another thing, I told you it will be like a snake-like structure, the shape of the feces, or sausage-like structure. If you see watery, and watery also, there is an abnormality. There are so many reasons which can cause watery stools. Another important thing is there should not be any mucus. If you are able to see the mucus, then that is again indicating there is some abnormality in the gastrointestinal tract. It should not be foamy. Then color of the stool. If the color of the stool, yellow color, then it may be having a pancreatic disease. If it is having pancreatic disease or cholecystic or some secretion related problem from the organ like pancreas and gallbladders, you will have color changes like this. Another important information, whenever you look at the color of the stool changes, if you are able to see the dark color stool or fresh blood, it is an emergency. You cannot ignore. There are something, as a pet parent's point of view, if the new diet introduced or anything, corrosive substances eaten, in those cases, if it is having a bleeding from the GI tract, there is a blood, digested blood on the stool is okay. There are several conditions like platelet reduction due to various infection region. You will have a bleeding. That is an emergency. The puppy may be quite all right. Because of bleeding from the internal organ, especially from the GI tract, suddenly they collapse. So this is a very warning sign. You need to carefully make a note of it. Another important thing, the stool itself, it will tell you, my professor used to tell me, if you are carefully examining the stool, 10 to 15% of the diagnosis can be made. The another important observation is, if you are able to see rice-like structure on the feces or white-like structure on the feces, it is indicating there is a worms that is present in the feces. that would have come from that particular dog. These are all, see, there are 5 diseases you can make it. Pancreatic disease, presence of worms in the particular dog, bleeding disorders, and dietary abnormalities. So, all those things, infection origin, all those things you can make out without doing test. You can make out all these observation, and many pets, they will not be able to tell their problem. It is the responsibility of the pet parents. You are like a pediatrician. You are the one going to be with the pets for 24 hours. For me, if I am examining I have a 10-20 case, I'll spend maximum of 10-15 minutes with your pet. The whole story you may be knowing. So this will give you a maximum information to you. Maybe with the availability of smartphone, take the stool pictures, store it, interact with the veterinarian. When you are explaining the current problem, the vet may not be able to grasp within 5 to 10 minutes. So if you can go with the smartphone device, images, videos, that will give added information, and it will give a proper diagnosis to your pet, and thereby your stress will be relieved, animal stress will be relieved, and both of them will be happy.
So it is very important as a pet parent that they should notice how a stool of their pet looks like, and if they can observe any abnormality in the color or in the texture or in the shape, they can definitely contact their veterinarian, and they can at least treat the disease before worsening. Right, sir?
Yeah, that's what.
Yeah, sir, you mentioned about parasites. You also mentioned about some infections. So I believe that deworming and vaccination are very important for the health of a puppy, especially puppies. Okay.
Yes.
So can you please explain about the importance of deworming and vaccination, and also you can also mention the deworming schedule. Because I will give you an example, sir. I have seen many pet parents. So they used to purchase a deworming syrup for a puppy, and they will be giving it for 4 months, because they are going to give only 1 drop, and they will be giving it for 4 months continuously. Is it effective? Or do they need to change? So please give your view, sir.
Again, I want to quote my professor example. I told you 20% when you look at the feces, you can make a 20% of the problem, free from your pets and disease. If you are able to properly deworm, 50% of the disease can be eradicated. If you are properly vaccinating, 70% of the problem can be avoided. Your money will be saved, your time will be saved, and your tension will be avoided. And the most important thing is there are a lot of studies and a lot of work they have carried out regarding the deworming. I want to quote one example, what we observed in some of the reputed clinic in the city, some shelter, a reputed, organization, wherein, the well-maintained dogs, periodically they give deworming, periodically they give vaccination, but all of a sudden, they developed illness. I couldn't quote which organization because in this platform, but it's highly trained people keeping these dogs. What happened? They missed. So all of a sudden there was a dark colored feces, and they missed a couple of dogs. And there was an inquiry why the well-maintained dog it become suddenly it becomes become ill, and they paused. They mainly used for detective purpose and various other investigation purpose. And we look into the details. Where was the problem? And as Anish was mentioning, the deworming they give once in 3 months, and they say everything can be eradicated. The particular investigation we collected the material from the surrounding. We collected the material from the lawn where the dog is playing, where we observed all the places ankylostoma egg positive.
So ankylostoma is a parasitic disease. So it is a parasite found inside the intestine of a dog.
It is it will suck lot of blood. It will make your pet become anemic.
So for the viewers to make it easy, it is a hookworm.
It is a hookworm, blood sucking worm. it will make dog become dull. They won't eat, and the mortality rate is very high in puppies. And so that particular case, what we did, when we carefully examine, and we advise the existing protocol. The existing, suppose they are giving some X drug, we told them to stop. We told them to go for some Y drugs, and we increase the frequency of it. For example, Anish was asked, what is the frequency? See, they say you need to start as soon as the puppy born at the age of 2 weeks. 2 weeks, you need to give the deworming. After 2 weeks, again you need to repeat. Then after, when they are attained 6th week, you have to repeat. Then 8th week, you have to repeat. 10th week, you have to repeat. Then 12th week, you have to give. Like that, you need to repeat this interval. Then 4th month, 5th month. Then after that, you can give once in 3 months. And nowadays, what they are advising, even you can, once in 6 months, go for stool testing. Even master will check up a human being, the stool test. That is the one it will give utmost authenticated value. Based on that, you can plan for whether you need to increase the frequency of the deworming, or as suppose we are giving once in 3 months when they are adult, you can continue with this. And
so we have an interesting question, same related to this topic, sir.
Yeah.
So this is from Mr. Majumdar. He has asked, good evening, doctor. My Labrador male puppy is 1 or 3 days old. My question is, after 3 months of age, what should be the frequency of deworming for my puppy? Is it monthly once?
Up to 6th month, you can give, once in a month. Then after that, you can switch over to once in 3 months.
3 months.
3 months.
Okay. So Abhishek, the answer for your question is for the first 3 months, once in 3 months, so twice in a month, and after the 3 months, once in a month. After 6 months, you have to give once in 3 months. Right, sir?
Yeah.
So, and sir, can you please help the viewers to understand about the vaccination schedule also?
Yeah, this is very, very important. See, we have gone through the lot of informations. Why? See, I have a Doberman. Some of my colleagues are having a Rottweiler. Some of the other friends, they are having a Labrador. These breed, it cannot be given vaccination like other dog, especially breeders and the pet owner, those who are having these breeds. You have to be, understand the science behind this. These breeds, they don't have a proper immunity like other breeds, especially the vaccination booster status. The Doberman, very intelligent breed, and it protecting the territory. These are all plus point, especially coming to the immunity titer value. The Doberman, Rottweiler, Labrador, these 3 breeds, if I am vaccinating, actually the recommendation is at the age of 45 days, you need to give a Parvo distemper 7-in-1 or 9-in-1 commercially available vaccine. You will have to give. Then after 21 days later, you have to give that is the 45 days is the primary. After 21 days later is the booster, first booster. Then what I am doing in my practice. Then again, after 3 weeks later, I will give second booster. So with this schedule, I am able to cover the core vaccine. When they are attained 3 months of age, I will put him on the anti-rabies vaccine. So the vaccine should cover parvovirus, distemper, adenovirus type 1, type 2, para-influenza, leptospira canicula, ictera hemorrhagica, all these strain it should cover. And with my 25 years of service, there are so many brands which I used. Now I am stick on to some of the strain containing vaccine. This titer value we checked in some of the other countries. We checked, for example, you take rabies. Rabies, suppose Anish is saying here, suppose he is moving to Italy for his business. So if he is traveling with his pet, he has to give the titer value to Italian government. Okay. And some of the country, they insist the vaccine, the titer value should be checked in their own country. For example, Anish is moving from here. The Italian government insists they want to do the titer value in their own lab, not in India, not in any other country. So we have after this vaccination schedule, we have collected the blood sample. We send it to some X lab in the Italy. stating that we need a vaccination titer value. The vaccination titer value for rabies, it should be 0.5. If the titer value less than 0.5, Dr. Anish cannot move to Italy. They will not allow without the titer value raising. And suppose the Anish is the CEO of a big company and they paid very well, and the dog titer value is very less. If he stay means he has to pay from his packet. Each and every pet owner, they're staying in a bigger house, they have to pay higher rent. So the message is, especially dog like Doberman, Rottweiler, Labrador, these breed, especially Parvo, distemper, all these strain, when you are vaccinating or rabies, do an additional dose. If you have a doubt,
we have to give a second booster.
Maybe I am putting 3 vaccine. Okay. Probably you have to give 4 or 5. That is the way these puppy get a sufficient immunity. Otherwise, some country they're testing titer value for Parvo and distemper. Even here also, some of the private people, they to see the titer value. If the titer value above the normal, you are safe. Your puppy is safe. If it is less, you need to go for additional vaccination. This is the message. Okay. And then after that, every year, Parvo, distemper vaccination, rabies, and these vaccinations are core vaccine. Now we need to repeat.
Yes.
Yeah. There are vaccines, they start the kennel cough at the age of 1 week. The puppy DP, they start, after 3 weeks later from kennel cough, they start. These are all some of the schedule. But major, as per the World Small Animal Veterinary Association guidelines,
we should follow DHLP and rabies, right?
Yes,
sir?
that is the message.
Yeah. So
another question from Surendran Govindan.
Yeah. So he has asked, "Hello, doc. My beagle puppies are not having dry food. They eat home food. What should I do? Encourage eating dry food."
Yeah, see the psychology of the dog. When they used to that same food, and home food is not the balanced one. And when you want to, your message is how to make my dog to eat dry food. So slow introduction. Probably the existing homemade food. Take little quantity of the commercially available pet food. Just spray on that. Thereby, slowly it will accustom. Then by upon particular time, it will try to eat.
I will like to add some more points.
Please.
Yeah, sir. Actually, Mr. Surendran Govindan. So you should understand the basics of the digestive system of a puppy or a pet. For example, there are some bacteria. There are both good bacteria and bad bacteria available in the large intestine of a pet, and we also have the same microbial flora, but there is a difference. So that difference is that we can eat any type of food, that is the reason why we eat biryani in the afternoon and paratha or chapati in the for dinner. But dogs and cats, they are not accustomed to, for different diets. So for these for pets, they are adjusted to one particular diet, and when you are going to introduce a new food, definitely it depends. It will take time for them to get adjusted to that particular food, and that's why for every pet food industry, pet food companies, they mentioned to take 7 to 10 days of time. So you have to introduce 1/10 of the dry food every day. So by the 10th day, you will be introducing a complete diet. And one more thing, if your pet is not eating, don't force feed, or don't feel that my pet is not eating dry food. And if you end up giving home food, definitely it will not take dry food, because home food contains more moisture and pets love more moisture. Sir, we have another question from Mr. Ratul. So he has asked, for my lab puppy, I gave puppy DP at 45 days, then 21 days after DHPPI. After 21 days, corona. After 21 days, rabies. Then after 21 days, DHPPI. Above these are okay.
Yeah. The first dose, you at the age of 40 days, you are in distemper and Parvo. Then DHPPI 21 days later. Then in the middle, you are covering corona. Then rabies. Then finally, you are giving DHPPI. See, normally almost 3 doses of December Parvo you are covering. This is okay. There is some variation, but there is a gap of 21 days. This is definitely, it will suits your puppy.
Okay, okay. Sir, so as we were talking about the vaccination, so I personally have an experience. When I started to be raise a puppy, so it was during my initial college days. So I had a German Shepherd puppy of 45 to 50 days of old, which I have lost actually because of Parvo. So as a common human being, I always felt that whenever there is a diarrhea or vomition, there will be dehydration, and so you have to drink more water. So we do like that. So similarly, what happened during this time, the puppy had Parvo, and I ended up giving him glucose water, extra. But unfortunately, I could not save the puppy. And then, while coming to the veterinary medicine, fourth year of the BVSC, I came to know that we should not feed anything. We should not give drinking water at that point of time when the puppy is continuously vomiting. So, what are your thoughts on this, and what is the advice as an expert you would like to give it to our pet parents? Because Parvo is a common thing which every pet parent will go through.
Yeah, the dog which are vomiting due to parvoviral disease, there are two forms. The parvoviral disease, it will attack the gastrointestinal tract. Another form, it will affect the heart. Immediately, mortality rate will be very high. But the parvovirus attacking the heart is a lesser percentage compared to gastrointestinal tract. The parvovirus, once they get, because suppose Anish, when he had a puppy, that had a parvovirus, that will be in the premises for several months. So the environmental sanitation is very important. And usually the best detergent is, for the pet owner, we use a bleaching powder available in your house. Use the bleaching powder. You just sanitize the area by using the bleaching powder. The parvovirus, effectively can be controlled with that. Then coming to the dog which are not eating, most of the pet parents, they try to give, even the vomiting they try to give. That should be avoided. The message is, dog which are vomiting, having diarrhea, the GI tract rest is very important. If the GI tract you are not providing the rest, if you keep on giving, the hydrochloric acid getting secreted from the GI tract, again it will induces the vomiting. So if you give the GI tract rest, that will help them to recover at least 6 to 12 hours. If they see existing problem will be there, that can be controlled by this type of managemental tips. Keep them under empty stomach. Then you take it to a vet. He will administer the essential intravenous fluid. Thereby, it won't, the electrolyte essential component of their survival. All these things they'll give in the form of IV drip. They'll give. If it is administering the IV drip, there are certain fluids they select, depends on the condition of the dog. Once they give IV fluids, you are vomiting, diarrhea, everything will stop. Then after that, so there is no vomiting and diarrhea, maybe you can try oral rehydration solution, ORS, little quantity, don't give too much. Maybe if the puppy is 2 kg, you have to give 1 ml. The 1 ml also, you give some anti-vomiting drug, depends upon the recommendation by the veterinarian. Give an anti-vomiting drug, wait for 10 minutes, then give this oral rehydration solution. Or you can give a tender coconut that contain all certain electrolyte. This will compensate their need. So that's the way you need to manage. In case of animal with the parvoviral disease, some treatment regimen, the vet they'll follow. Periodically, you need to. This is a very serious disease, parvoviral disease. Still, only by vaccination alone you can protect. So how the coronavirus infection, it's an alarming problem to the human being. Similarly, the parvovirus is an alarming problem among the pets. You'll have a lot of mortality. If you're having a 10 puppy or 3 puppies in the house after the whelping or after the delivery, you will get mortality in all the puppies. So the mother immunity is also very important. If you don't give a proper vaccination to the mother, if the mother dog is having 10 puppies, that means 10 puppy, they will not get sufficient immunity. So mother dog has to be immunized. Once you immunize the mother dog, the Parvo titer value, it will be shared by the 10 puppies. That's also very less. If the 5, compare with the 5 puppy and 10 puppy, 5 puppies group, they have a good titer value because they're getting more amount of immunity.
Which means that if the number of puppies are going to be high, the chances of the Parvo infection is going to be high.
Yeah, that is the message.
The immunity not high, the immunity level would be little bit less. So I also wanted to add, sir, Farmina. In Farmina, we have VetLife gastrointestinal product. So during the recovery phase of Parvo, we can also add VetLife gastrointestinal product, because gastrointestinal, we use hydrolyzed proteins, which will not give much damage, or which will be easy for which will help in easy absorption of the ingredients.
Yes. Yeah, this is the many pet parents, they tried and given a good feedback when they recover from the parvoviral disease. Maybe we can try on this diet.
Yes, especially the wet food, sir.
Yes.
Yeah. So we will go to another question. So this question is from Mr. Pratap Singh. Hello, sir. I have Bernese mountain dog, male, 11-month-old. My dog is having one testicle in the pouch. Okay, crypt orchid. So what should I do? He is very choosy about food. He never run for food like other dogs. He doesn't eat dogs at all. Please help. It's a common problem, and it is especially with the small breeds. Yes, but in this case, you have to tell your opinion, sir.
Yeah, actually, the one testicle in the pouch is called monarchid. And the monarchid dog, normally, if you are a breeder, these dogs, they will not use it for dog show when they become bigger. Another thing, if I am the female dog owner of a Bernese mountain I will not allow your dog to breed, because my puppies also, they develop single testicle because of the genetic transfer. So what the American Kennel Club of India insists, they won't breed these type of dog having a single testicle, and they will not entertain in the dog show. That is the one message.
So I think, sir, his question is there a relationship between one testicle and the choice of food, the palatability, the number of frequencies it eats?
No, that is no way connected. The presence of single testicle, and then he run for you mentioned, very choosy.
He's very choosy.
Choosy. There is no correlation. There is no correlation. That is a separate entity. Scientific basis are there. Then another testicle, one testicle may be here, another testicle may be inside the abdomen. The dog can't breed. It can also the female can get the puppies. But this type of issue will be there. That is the other story. Coming to your food causings, there is no correlation between the presence of single testicle and the choosy food characters. That's because the individual nature, and probably there are wet food also available that you can try. If they don't like dry food, you can try with wet food, or maybe the slow introduction of the existing pet food. Definitely they accept as the time advances. Anything by close observation, and by giving the small quantity of feed, thereby definitely they'll accept the commercial pet food.
Yeah. So, Mr. Pratap, I will also want to add that. So it is a common nature in some pets that they are always choosy. So there are very limited things which we can do. So best thing is that, say, always pets love wet foods. So you can try on adding along with the dry food, you can start mixing wet food. So it can increase, because it can increase the palatability, because wet food have more taste and more smell. The smell would be very stronger. So you can try like that. Sir, so he has also continued, sir, 2 more questions. How should I get confirmed that second testicle is there or not? My Bernese dog doesn't like eating anything available. I tried everything available: curd, eggs, goat, chicken, goat meat.
You try with more of liquid item. Coming to the food category, confirmation. No, you need to go for ultrasound, sir. An experienced ultrasound person can make out the presence of a testicle in the abdomen. It may be in the abdomen. or it may not be there. That's the way. When you do an ultrasound, you can trace.
Mhm. Sir, coming back, sir. So Parvo, the hookworm infection, they are all seen in sick dogs. But in my experience, I have seen many pets, and this is the often complaint raised by a pet parent. They change the food. The pet is healthy, but there is the stools are little bit on a little bit loose or pasty stools. So, what are the what are the various reasons for having a loose stools when they change a diet?
Yeah, sometime when they are allergic to certain food
Uh,
or sensitive to that particular food, they develop diarrhea. For
mhm,
that, there are many pet food commercially available. If you can offer that, no, you can avoid this problem. Actually, the dog, there are many studies they carried out. Dogs, they are allergic to certain proteins.
mhm,
Maybe few dog they allergic to milk protein. That is a commonly used product in our Indian feed to the dog. Another thing, chicken is the common food we normally used. Majority of the dog they allergic to chicken protein. Another product is mutton. Mutton also allergic to certain food. And some of them they feed beef. Beef is also allergic to certain food. So the protein that are present in the egg, milk, or meat, they allergic to dogs. So those dogs they develop diarrhea. Sometimes they vomit. They lose weight. There will be abdominal distension, abdominal discomfort. There will be a gas formation. All those signs it can be encountered in case of the introduction of the new diet. If you are able to see, suppose my dog having these sign after feeding the chicken with rice, that means I need to stop the chicken in the rice. For that, for me, with the available household food, I will not be able to correctly quantify, scientifically alter is very difficult. So
mhm.
there are pet food companies, they have a product, and they are scientifically proved, and there are very good scientific team working on that benefit of the dog. There are experimental trial they carried out. Based on that multi-crore product, it's available in the commercial pet food. And the dog which are having these allergic to protein, they're prone to develop inflammatory disease, and the bowel wall become thick and they become weak. They will not put weight. It's become continuous problem. And when you put them on these type of diet, they'll gain weight, and all these problems can be minimized.
Yeah. So in Farmina, we have a product called as VetLife Ultra Hypo, and we have NND products. In NND Quinoa, we have products like digestion. We have products like Skin and Coat, which are meant for food allergies. So we introduce single animal protein sources, and which will help to reduce allergy. And in Ultra Hypo, we have used hydrolyzed proteins. Hydrolyzed proteins means proteins which are smaller in size of 6,000 Daltons, so that it can be easily absorbed and it will not produce any inflammation. And sir, coming to the point, so as you mentioned about food allergies, and another common thing which we always see in a pet with a pet parent is that either the pet will be vomiting, either once in a while it will have loose stools, it will be passing so much of gas, farts, and there are often other complaints saying that my pet is not gaining body weight, he is losing its body weight. What are the different reasons for this, sir?
Yeah, this is a particular condition. They call it as inflammatory bowel disease, and wherein they become emaciated, vomiting, diarrhea, weakness, and these are all the characteristic symptoms in case of inflammatory bowel disease. There are so many reasons why the dog developed this in short form they call it as IBD. The
Hmm.
similar problem encountered in human being also, and the reason for this, some immunological mechanism behind it causing this problem. We encoded in German Shepherd, Boxer, Spitz. All these breed they prone to get the problems, and once they get it, it is very difficult to manage with the routine diet. There are commercially available food, that can reduce the inflammation in the GI tract, especially intestinal region, colonic region, and the bowel become normal, and you'll have a good recovery from this.
Yeah. So in Farmina, we have products like VetLife Ultra Hypo and gastrointestinal products, and which have hydrolyzed proteins. As I mentioned, the proteins are broken into smaller pieces, so it will reduce the inflammation. It would be easily absorbed by the intestine, and which will reduce the stress of the intestine of a pet. And I would like to also mention, sir. So we are doing a research with Dr. Simpson, who is a renowned veterinary gastroenterologist. So we are doing a research with VetLife Ultra Hypo on inflammatory bowel disease with Cornell University, which is the best veterinary university in the world.
In the world.
Yeah.
Okay.
So
another.
I am. Yeah.
Yeah.
So
Tell me, Anish.
I am getting a question from Mr. Pratap Singh, the person who was talking about the testicles, monoorchid pet. So he's asking, can any surgery bring it down to the pouch? And followed by, he has asked, it is a giant breed. Adult weight is 70 kg. As of now, he is 43 kg and 25-inch height at shoulder. What should be the ideal quantity of food?
Yeah.
So
coming to the
I think
the first part.
He should
First
mention.
part. Yeah.
He
First
should
part
mention
I'll
the
answer.
age of. He should mention
yeah.
about the age also, age of the puppy. Yeah.
Yeah.
Yeah. You
The
can
first
continue,
part
sir.
I will answer. The second part you take it, Anish, regarding
Okay.
the nutrition aspect. The first part is asked whether the testicle he can bring back to the pouch. Yes, that is possible. First, you check whether the testicle is present in the abdomen. That's very important. The senior ultrasonographer only can trace. With the X-ray, it's quite difficult, but the ultrasound definitely they can make out. Once that is there, with the experienced surgeon, you can bring back the testicle into the pouch. That's one thing. Another thing, the weight of the dog. Is a giant breed dog. Okay, is the adult weight is 70 kg. As of now, is 43 kg, 25-inch height at shoulder. What should be the ideal quantity of food in a day? So, what is the Farmina recommendations, Anish?
So the recommendation is that, sir, it depends upon the age of the pet, and it will depend upon the activity level of the pet. It will depend upon the neutering status of the pet. So it is difficult to calculate and tell right now. So you can log into farmina.com/in, where you can take our help of our nutrition consultant. They will be more than happy to give you a recommendation, nutritional recommendation.
Yeah.
So coming back to the question, sir, I have one more question.
Shivani.
Shivani.
One question from Shivani.
Yeah, she has asked, my
is,
dog intermittently has traces of blood in the poop. I have got samples done, and there is no evidence of parasite. So it usually happens around slightest change in the diet. What could be the possible causes? I think it was the same topic which we were discussing right now.
Yeah. Yes.
Yeah. So you can tell me, sir.
Yeah, probably the blood in the stools, it can be, there are two reasons. One is it may be allergic to that food, or it may be having inflammatory bowel disease. Probably by putting on a hypoallergenic diet or the GI diet, you can overcome this problem. You need to check with your vet, and accordingly you can try this, Shivani. But your statement is concerned usually happen around the slightest change in the diet. Probably the dietary sensitivity may be the reason for this. And probably you need to work with the attending veterinarian, so thereby they can prescribe the correct diet for your pet, maybe ultra hypo or GI diet.
Yeah, Miss Shivani, I have mentioned during my discussion that you can always try VetLife products, VetLife Ultra Hypo and Gastrointestinal. So your pet may be suffering from, I am not sure, but it may be suffering from inflammatory bowel disease or any hydrolyzed diets, diets with hydrolyzed proteins like Ultra Hypo or Gastrointestinal, they can be of use for your pet. Sir, coming back, sir. So in some deep-chested breeds, sir, for example, like Doberman, Dalmatian, Dachshund, who have a deep chest. So we have often seen that, sir, after having a heavy meal, and if they are going for an activity or if they are going to play, so they will be playing and suddenly they will start to collapse. This is the most common problem which we have seen, especially with the deep-chested breeds. I have n number of enquiries from the breeders on this case. What is your suggestion, and what should be the steps which we should keep in mind?
Yeah, I agree. All the breed. The another most important breed is the Great Dane. 75% of the incidences, they encountered in these they call it as in so pet parent point of view. If I tell stomach become bloated, distended, and it become twisted due to excessive gas formation. That gas formation, how it's happening? Even human being also now to reduce the weight, they advise us to take little quantity of food, different interval. Not eating everything at a time. So what happened? Bigger dogs like Great Dane, Dalmatian, German Shepherd, all the Doberman, all these breed, when you are offering the food, the secret of the dog affection and rearing, they are fond of food. If you are giving food and they will obey you, the secret of dog training, the trainer will give the treat. The secret of dog attached with the attendant, not with the owner, because the attendant is feeding. So the secret of the dog is you need to give the food. That food also, whenever you feed more huge quantity of food at a time, they gallop like anything, and suddenly when it goes into the stomach, some of the organism interact on that, fermentation takes place, the lot of gas formation. When the too much gas formation in the stomach, it get twisted. When it's become twisted, it will compressing your thoracic cavity or the diaphragm, this particular area or chest region. You take chest region for pet parent point of view. The chest is having an important organ like heart and lung. When it is compressing, it beat more, and it send when the beat more, it send less amount of blood to the circulation. When there is less amount of blood to circulation, kidney failure will occur, and the animal cannot breathe. Because of this, the animal die with multi-organ failure. All the internal organ damages, so many problems can happen. The message to the pet owners: if you are having a bigger dog like Great Dane, Dalmatian, German Shepherd, Doberman, these breed, small quantity of food at different interval you need to feed. So that's the way.
Don't feed at one time.
Don't
feed a heavy quantity.
Heavy food. That is the message.
Yeah.
So.
Yes, sir. So during this case, sir, if a pet has a gastric dilation volvulus, we call it as gastric dilation and volvulus. Volvulus means twisting. So during this case, also you can try on VetLife gastrointestinal vet food available with Farmina. So since we have used hydrolyzed proteins, it can be easily absorbed. But most important point, as mentioned by Dr. Chandrasekar, we have to give it multiple times. At least 6 times you have to split the food and you have to feed. So I have a question.
Cooper.
Dr. Sherlyn here, question for Dr. Anish. May I come for internship? So we will discuss this, doctor, after the session. Thank you for your interest. Yeah. And so we have a question. So Mr. Kamkar, he is saying, I faced the same issue. I stopped chicken rice and convert to VetLife puppy growth under the supervision of Farmina nutritionist. Stool problem, gas, losing body weight, and after changing to puppy growth, she has recovered and growing fine. Regularly contacted with Farmina nutritionist as well. Thank you, Mr. Ratul Karmakar. So thank you for showing your trust with Farmina. Sir, one more question, sir. So these things we have seen with adult dogs. When a pet approaches seniors, especially with the dogs. So we have seen a lot of cases where they are unable to digest fat or pancreatitis. We can say pancreatitis. Can you please tell, sir, what are the common things which affects common problems which affect the digestive system of a pet when they are senior?
Yes. Usually, the one message I want to share, one of my friend, my classmate, is a practicing veterinarian in Canada. And he was practicing here. And he finished the board certificate examination. He's having his own clinic in Canada. And he told me when I went to Canada for a conference, he asked me, how many percentage of pancreatitis you'll get in our practice? The question is, The household diet fed dog, not the commercial food. Household diet dog, his assumption is no, the more of fat. I'll provide chicken with rice, I'll beef with rice, or mutton with rice. That contain lot of fat. Once they eat a lot of fat, naturally, aged dog, they may not be in a position to utilize the maximum amount of fat. They're prone to develop a pancreatitis. Actually, the dog with the pancreatitis, you need to give a less amount of fat. And if you give like this, it will aggravate the problem. And once the pancreatitis occurs, there are some substances getting secreted from the pancreas. It will goes into the circulation, going for shock and death of the animal. It become weak, vomiting, diarrhea. They will not eat. So less fat diet. There are many food they have commercially that you can food animals suffering with the pancreatitis. Yes,
Yeah.
Anish.
So, for the viewers, if your pet have a pancreatitis issue, you can always try our Farmina products. We have two products with us. One is NND quinoa digestion, where the fat percentage is very less than 10%. I believe it is 8%. And we also have a gastrointestinal product in VetLife. So where the fat percentage is approximately 10%. So you can always try our product, because this is a common condition in dogs and it is absent in cats, and this is the only solution which you can give it to a pet. Sir, coming back, we have talked many things on dogs actually. So as a veterinarian, sir, what are the common digestive issues which you see in a cat?
Yeah, cat, usually GI tract disorders in cat, there will be a vomiting. Another problem, there is a condition called megacolon. They have a distended colon due to fecal impaction.
For the viewers, colon is a part of large intestine.
Large intestine.
Yeah.
When the fecal getting impacted, they will not void feces. And, that's because of the less fiber in the diet. They are prone to develop this type of megacolon. Sometimes, there are so many reasons the animal become upset. When they are upset also, they will not void feces. Even the litter material is not clean, and they have a tendency to, they won't void. Normally, you see the cat, they create a pit, and then the void feces and the urine, they cover it. So those who are living in the apartment or the flat, you need to provide the litter material to void them. If you don't provide that, naturally they are prone to develop all these issues like urinary incontinence, or lower urinary tract obstruction, or they can prone to develop a megacolon due to less fiber in the diet. If you can give, there are preparations having more fiber in the diet, you can avoid, it can form a easy stool, and it can avoid the stool very easily.
Yeah. So, yeah, it's fantastic, sir. So I believe, sir, we have answered most of the questions which a pet parent often faces, and it was very nice of you, sir. You have given given clarity on the questions in a very simple way. I believe this is the best thing which a pet parent can get. And now we are going to coming to the end of the session, sir. Thank you for accepting our invitation and to be here, sir. Thank you very much. Yeah. And for the viewers, once again, we will. I think we got some question. So for the viewers, once again, thank you everyone for making this session a lively one, and making our live session a successful one. Once again, we will be back with an interesting topic on next Farmina Nutrition Hour. Till that time, thank you and bye. Thank you, sir.
Thank you. Thank you, Farmina, and that team. And pet parents, it's a golden opportunity to make use of it. If you want to meet me, you cannot meet me so easily. And Anish followed me every hour where I am, whether I am available for online. So many people are watching, and they are meticulous in arranging this online consultation. Actually, it's a good opportunity. Even if you come to my clinic, you need to wait to meet me. But here, the viewers can get ready-made information. I thank Farmina and that team for excellent effort bringing the industry knowledge to the field level. Thank you once again. Thank you very much.
Yeah. So once again, I have missed one thing. I will make a sum up for the pet parents. Good nutrition with a proper deworming and proper vaccination schedule. So you can, with this, you can avoid most of the problems. We will try to give a healthy life to our pets. Thank you, everyone. Thank you, sir. Bye.